Hello everybody, you are welcome to the Ultrasound workshop for the Virtual Vascular Access Society Congress in Berlin. In this workshop, we will present several cases of vascular access examination using Doppler ultrasound. We are a tertiary access center in Israel. We are receiving patients from the entire country. Thus, you may see today some complicated and interesting cases. I hope you enjoy these presentations and take home a lot of knowledge. Let us start then. This patient is a 58 years old male on hemodialysis, diabetes mellitus, and hypertension. He has a radial cephalic fistula. You can see it here. You can see that there is partial emptying of the puncture site. As you can see here in this, it's a little bit pulsating. There's a nice trill here. But when he elevates his hand, there's emptying of the puncture site, as you can see here and here. So let's see what the problem is. Okay, we start with the anastomosis. Here is the radial artery and the confluence with the cephalic vein. You can see it over here. This is the radial artery. This is the fistula. If we take it at this direction, you can see the connection between the radial artery and this here and the cephalic vein. It's quite enlarged cephalic vein. Let's put a color so you can see the connection. There's some turbulence near the anastomosis, but the most important thing here is measuring the flow. And if the flow is okay, then no need to do anything. You can have the impression of the flow in the fistula, very turbulent flow. As you can see, a lot of systolic and diastolic flow, which is typical to the fistula. We go to the puncture site. Again, we can take it in grayscale. You can see some calcification in valves in the vein, but they are insignificant here. You can see it over here also. Probably this is an old valve, and this is the puncture site here. You can appreciate the high flow in the fistula. We soon will measure it. The diameter of the puncture site is the arterial puncture site is 19 millimeters, and this is the venous site, well developed. And we continue with the transverse view. You can see here. We saw something. There's some narrowing here. You can appreciate that. And here, this position near the elbow, you can see it's a mild stenosis actually here in this point. I will mark it here. This is cephalic vein, mild stenosis. We can remove. We can see here some traces of a valve inside that's causing the stenosis probably, but it's only very mild stenosis. So we continue with the vein. The vein is draining to the cephalic vein in the arm. You can see that. You can appreciate that the flow in the cephalic vein is relatively low to the flow in the basilic vein. This is the median cubital vein, and this is the basilic vein. So most of the flow goes to the basilic vein. So let's measure the flow in the fistula. We follow the basilic vein here. See, the most of the blood go to the basilic, and it's good for the fistula. We measure the flow by simply take a straight segment of the artery. This is the brachial artery. Here we reduce a little bit the color to avoid aliasing. We freeze. Now it's so simple to measure flow here. It's just fantastic with this machine. Just you measure the diameter of the artery. You can take one heart cycle like it's in this frame, or you can take several heart cycle, and you can see that the flow is about 1400 milliliter per minute. So if you reduce the flow of the arm, probably this is about 1300 milliliter per minute. This is about the flow in the fistula, which is quite good. So the only problem we have here, if we have at all, it can have some bleeding from the puncture site from this side, in spite of the fact that he has emptying of the puncture sites. And this can be from the stenosis at this point. I will show you. But this is very mild stenosis, and no need to do anything about it right now. Okay, I think we are done here.